Hello, my name is Alyssa, and I'm here today to discuss the negative effects that smoking has on the body, as well as the community, and to explore methods of smoking cessation through the integrative review process. Smoking tobacco has become a major health concern, which causes a plethora of preventable diseases. Some of the negative effects of smoking include COPD, emphysema, cancer, heart disease, stroke, and asthma. Smoking around children increases the probability of sudden infant death syndrome and sets them up for asthma and other diseases later on in life. Not only will the cessation of smoking improve the health of the individual who smokes, but it will also improve the health of people in the community as well by decreasing exposure to secondhand smoke. There are two studies that were reviewed for the integrative review process. The first one was a preliminary randomized control trial of a behavioral exercise intervention for smoking cessation. The second was a pilot randomized control trial to assess the methods and procedures for evaluating the clinical effectiveness and cost effectiveness of exercise-assisted reduction then stop among disadvantaged smokers. In the first research article, the preliminary randomized control trial of behavioral exercise intervention for smoking cessation, the intervention participants were to attend aerobic exercise sessions once a week at the research facility, as well as engaging in a minimum of 2 to 4 additional times a week in their own environment. The participants also received 20-minute weekly sessions of behavioral techniques counseling to guide the participants towards increasing their overall physical activity. The control group was labeled the Health Education Contact Control, and they received weekly hour-long health education sessions related to the effects of smoking. Both groups also received 20-minute weekly telephone counseling sessions, as well as an 8-week course of transdermal nicotine replacement patches. So the findings reported in the study revealed that the intervention group demonstrated much higher percentages of 7-day point prevalence abstinence, as well as continuous abstinence compared to the control group. The study also revealed a significant decrease in withdrawal symptoms, such as cravings with a p-value of 0.00, affective symptoms with a p-value of 0.00, somatic symptoms with a p-value of 0.00, and in sleep symptoms with a p-value of 0.02. So all of these percentages and p-values prove that exercise was effective in decreasing withdrawal symptoms and also helped prevent these patients from continuing to smoke. The second study that was reviewed was a pilot randomized control trial based upon the EARS program in Australia. The intervention arm consisted of 8 weeks of one-on-one support from a health trainer, in person or by telephone, whichever the participant preferred. Sessions included therapy based upon increasing physical activity. And then the control group just received care as usual. The participants in the intervention group were also given subsidized access to physical activity, such as gyms or parks, in order to help promote their physical activity. The findings revealed in this study suggested that a program could be beneficial in the cessation of smoking. The intervention showed a 14% abstinence rate compared to 4% for the control group 4 to 8 weeks following their quit date. The intervention arm also showed a 39% versus 20% achieved at least 50% reduction in the number of cigarettes smoked daily. So not only were they able to have some abstinence rates, but they also showed a decrease in some patients. They were able to decrease the amount of cigarettes that they smoked per day. The percentages themselves show proof that the intervention of increasing physical activity did improve the number of cigarettes smoked a day or just complete abstinence of smoking altogether. So now that the reviews have been shown, how do we improve our nursing practice? So we looked over it, and both studies proved the effectiveness of moderate exercise as an aid to smoking cessation. Counseling was an intervention that was used in both randomized control trials, and within the intervention as well as control groups. Both randomized control trials analyzed abstinence rates as well as levels of physical activity following the intervention phase. The major difference between the two studies was the inclusion of nicotine replacement therapy in conjunction with the exercise in our first study. The randomized control trial that utilized the nicotine replacement therapy in decreasing doses throughout therapy to decrease the cravings for cigarettes. Both randomized control trials included positive feedback with rigorous medical and psychiatric screening, as well as high levels of adherence in both the control and intervention groups. So the intervention proposal that I've come up with from these randomized control trials is to exercise 2 to 4 times a week at a moderate intensity, using 55 to 69% of your age predicted maximum heart rate as a marker for moderate intensity. Health counseling can be an excellent way to help quit smoking. And there are multiple tobacco cessation programs that are available, especially here in Kentucky. The implementation of these therapy options can be done in a primary care setting. The nurse practitioner can utilize counseling, open communication, and cessation program education to implement the exercise intervention. The patient needs to be motivated and develop a plan of action that's feasible for them. So the patient needs to be able to have some type of physical activity. Thank you for listening to my presentation on smoking cessation and the utilization of exercise as a mode for smoking cessation. As nurse practitioners, we need to have open communication with our patients and keep in mind that this is a very difficult journey for them to go on. Anytime you're in contact with a patient who smokes cigarettes, it is common practice now to give them smoking cessation information and free programs that are available to them. I thank you for listening to my presentation. If there are any comments, questions, or concerns, please let me know. Thank you.